Hey, what's going on? It's Dr. Mike T. Nelson here. And today I'm talking, I was going to say on the phone, but it's actually a computer with Dr. Michael Ruscio. And we wanted to get him on here and just do a short conversation about his new book that he has out. You may have heard me talk about him before. So he's a guy that I went to after I burnt myself out after my PhD to try to sort out what the hell was going on with my body and why it seemed to hate me at the time. And he was down with us down in Costa Rica, down in Dr. Ben House's place there at the Flow Retreat Center, presented some really great information about more of a how to do it yourself kind of gut GI stuff. And the nice part about that is that different protocols you can kind of try out on your own. And, if you get stuck after that point, then you can seek more professional help. So, yeah, great to talk to you.
Thanks for having me.
Yeah, no problem. So for people who may have been living under a rock, can you give us the short 2-minute version of your background in case they're new to hearing your voice here?
Sure, yeah. So when I was in college, I was on par to go into conventional medicine, ended up acquiring an intestinal parasite. I didn't know it at the time. I just knew that I started feeling quite ill. I had very bad insomnia, bouts of depression, quite a bit of fatigue. I was losing a little bit of weight, but I had zero digestive symptoms. But it turned out after seeing an endocrinologist, an internist, my general practitioner, no one found anything wrong with me. It wasn't until I ventured into the camp of alternative medicine that a gut-focused functional medicine doc suggested a parasitology evaluation and found an amoeba. And it was actually that amoeba that was causing damage in my gut, leaky gut, food reactivity, inflammation, that was causing all my symptoms, that I kept chasing down the symptoms thinking it was adrenal fatigue or hypothyroid or metal toxicity. And I pursued lots of treatments for those various things, but really didn't get anywhere. It wasn't until I addressed an underlying problem in the gut that I started to improve. And that was a very cathartic event for me. So I went more so into alternative medicine. Now I have a clinical practice in Walnut Creek. We've been performing some research. We have one IRB approval for a study that we're trying to get started, but procuring the placebo is actually quite difficult. So that study's been a bit delayed, but we've collected data for another study in the treatment of SIBO biofilm treatment. And of course, I wrote the book, as you just mentioned, and I've been quite active in this field in trying to help people get a reasonable perspective on improving their gut health without doing crazy bells and whistles testing or exotic non-validated treatments, so as to keep things economical and affordable, of course, and also trying to remind people that if they're not feeling well, a great place to start is with your gut health, because oftentimes problems in the gut can manifest, as they did in me, as non-digestive symptoms, but may actually be causing the non-response of what you think is adrenal fatigue or low testosterone or pseudo-hypothyroidism or what have you. So it's kind of the short story, I guess.
Nice. So I think what's interesting about that is that you said you were non-symptomatic. So if people are listening to this and they have some kind of GI type symptoms, it's pretty easy to recognize. But what is your thoughts for people who may not have symptoms? You had mentioned a few other things there. Is there a reason they should just kind of maybe start with their gut and make sure that's kind of up to par and proceed from there? Or are there kind of other things that you've found along the way that kind of point to the gut besides just the general symptoms that most people would have?
Well, sure. So as you're saying, if someone has bloating, constipation, diarrhea, abdominal pain, then a problem in the gut is a no-brainer, right, to investigate that. It gets more innocuous and more challenging when someone only presents with non-digestive symptoms. And this is where it can be hard. If you're a person going onto the internet and typing in your symptoms, trying to figure out what to do, you're inundated with several options. And so I think a better approach is to have kind of like a probability hierarchy where you start with the system that's most prone to dysfunction. you treat that system, and then you reevaluate someone's symptoms, and then you consider moving on from there. And so if we were to make a probability hierarchy, for most people, not for all, it's not a 100% guarantee, it's not a panacea, but for most people, if they've made some dietary and lifestyle changes and still aren't feeling well, then the next thing to do, having the highest probability of improving their health, is to perform a gut evaluation. And the symptoms are broad. You could have someone who only has a manifestation of symptoms that's dermatological in nature. And we see this with some celiac disease, full-blown gluten, gluten-induced autoimmune attack may only manifest as either neurological or dermatological symptoms. So someone may only have brain fog and fatigue, or skin breakouts, or even in some cases joint pain. All been documented that there is this non-intestinal manifestation in some patients of their celiac disease. And we see the same thing being published with small intestinal bacterial overgrowth. There's been some studies, for example, showing that people who have hives in one study, or urticaria as it's also called, the only symptom that they had, the only finding that they had underlying their hives was a Blastocystis hominis infection, which is a protozoa. So it certainly is possible that someone can have non-digestive symptoms that are being driven by a digestive problem. And in answer to your question directly, there is not necessarily one symptom that would be more or less suggestive of a problem in the gut. And so because of that, I come back to that probability hierarchy of starting with some basic dietary and lifestyle interventions. And if after you've done that, you're not feeling well, I would then go through an approach to try to optimize your gut health and reevaluate your symptoms at the end of that. In many cases, the symptoms will be gone, and then people can just get on with their life and not have to worry too much about health stuff anymore.
Very cool. You had mentioned, I know this is probably a review for most people listening to this call, but it probably bears repeating since everybody in general wants to start with the super advanced stuff, and gut health and GI health seems to be kind of all the popular thing, I guess, now, along with maybe ketogenic diets or something. But what would you say are the bare minimum or the bare basics they want to make sure that they cover before they go bonkers down the GI route?
What are the kind of diet and lifestyle basics to cover before going?
Yeah, not like a full in-depth, but just kind of a quick review so people kind of have that sort of checklist to go, oh, whoops, I'm doing good on these two, but I'm missing this one entirely.
Right. Great. Great point. So we'll go through it kind of in that hierarchy, putting these items first, which they definitely should be. Diet, of course, it would be a very good starting point. And there's a number of diets that someone could consider. A paleo diet is a good attempt at reducing inflammatory, or using the term loosely, allergenic foods. So things like grains, dairy, soy, and of course processed food and added sugar and trans fat are all pulled out by a paleo diet. So that's one option to start. Do you have to be 100% strict? No, but I'd say shoot for 80-90% compliance and give a diet about 2 to 3 weeks. And if you're not noticing a appreciable improvement in how you're feeling, then you may want to consider another diet. Paleo is one. I think low FODMAP is another one. That's FODMAP. It's a similar diet that pulls out foods that can be problematic for the gut. But to be honest, any diet that follows the general principle of removing processed food, added sugar, and focuses on whole, fresh, unadulterated foods tends to show a favorable outcome in the research trials when compared to no diet at all. And so I know that's very broad, but someone could even try a vegetarian diet, like a Pritikin type diet, or a Mediterranean diet. And if they're doing that and they're still not feeling better after a few weeks, or at least starting to improve, and then they ride that out to plateau, and they only plateau at, let's say, a 30% improvement, then they may want to move on to some of these more advanced items. But there's a couple other foundational factors, lifestyle being one, exercising the appropriate amount and not overtraining or undertraining. So if sometimes people come into the clinic and they're exercising for an hour and a half, 7 days a week, they have a lot of stress. They're working on their PhD, maybe like you are, and they have 2 kids.
Oh, bastards! What are they doing?
Yeah, right. And they're wondering why they're tired and they're kind of constipated and they have some brain fog. Well, I mean, geez, the allostatic load, the total stress load on this person is immense. So sometimes just reflecting on how much you're doing in your life, how much you're exercising, how much stress you're under, how much stimulants you're using, how much sleep you're getting, and then comparing and contrasting that with how much enjoyment you have in your life. These are some fairly important fundamental pillars, and you'd be surprised how profound the improvements can be just by attending to those fundamental pillars. So those are a few things to consider initially, and then if after doing that you're not appreciably improved, and I'd say at least 70 to 80% improved, then you may want to consider a gut evaluation.
Gotcha. So let's say someone's listening to this and they're pretty good on that. They're hitting around 80, 90%. Maybe they have a couple things to work on. So for the gut specific stuff, where would you have them start at that point?
So the first would be diet, and getting a little more into some of the gut specific diets. Paleo is one option to start, and then low FODMAP is another option to start. And if you visualize in your mind these 2 parallel tracks, kind of envision in your mind a pyramid, right? And we have at the bottom these 2 lines that are going to go from the base of the pyramid up to the apex of the pyramid. On the left and right, we could position paleo and then low FODMAP. And so someone could start with either one of those diets. Now, if someone has a lot of digestive symptoms, the low FODMAP diet may work a little bit better, but either one is a good starting point. So give either diet to start a 2 to 3 week trial, and finding diet guides. We have all sorts of diet guides for this on our website. They're readily available on the internet, but give a paleo diet 2 to 3 weeks. If you're not improving from that, try a low FODMAP diet for 2 to 3 weeks. If you're improving from either one of those, ride that improvement out until you plateau and then reevaluate. And of course, if you reevaluate at 90% improvement, then you're pretty good. If you plateau at 30, 40% improvement, then consider moving on. And the level 2 of each of these diets, paleo would progress to autoimmune paleo, which is a little bit more restrictive. So now this cuts out eggs, nightshades, and nuts and seeds, and beans and legumes. It's a bit more strict of an iteration of the paleo diet. It pulls out even more foods that may be inflammatory or, using the term loosely, allergenic. And then on the other side of the coin here, someone could progress to what's known as the paleo plus low FODMAP diet. And this combines paleo plus low FODMAP into kind of a combination diet. And the low FODMAP diet is restricting foods that feed bacteria. And sometimes people, if they're gassy or they're bloated, they have abdominal pain or they're constipated, sometimes there's an imbalance in bacteria. And if you're eating too much FODMAP content in your diet that feeds bacteria, this can be problematic. And this is something that is problematic for people. Foods rich in FODMAPs are synonymous with healthy foods, but they're not always good for an individual. So broccoli, cauliflower, asparagus, avocado, onions, garlic, all high in FODMAPs. Now, it's not to say someone would have to cut these out forever, but you may have to do a period of reducing these foods significantly to allow the microflora in the gut to rebalance and then build them back into your diet. So again, looking at those 2 tracks kind of going up the pyramid, on the one side, you're reducing inflammatory foods, paleo progressing to paleo low FODMAP. Paleo progressing to autoimmune paleo. On the other side, you have low FODMAP. You could go up a step and go to paleo low FODMAP, or the most restrictive out of all these diets would be the low FODMAP plus SCD, or specific carbohydrate diet. And this essentially combines low FODMAP plus the specific carbohydrate diet, which is kind of like a cousin to low FODMAP, which also reduces carbohydrates that can feed gut bacteria excessively or be hard for the gut to digest. And I know this sounds like a lot, but if you take it one step at a time, it's actually pretty easy. Day 1, here's your diet list. You're going to follow this for 2 to 3 weeks and then reevaluate. If you're feeling great, you're done. If you're not feeling great, you tweak to this next diet. You're going to do that for 2 to 3 weeks. If you're feeling great, you're done. If not, you continue through. And most people do not need to go through all of these. But for people with more progressed symptoms, it's nice to have these options to work through so you don't feel like you get stuck and have nowhere to go. So again, I know it's a lot kind of at first iteration, but if you go through it on your own, one step at a time, it's actually quite manageable.
Yeah, and I think it's good to have kind of, just like training and other stuff, have a progression. Right. I think people generally, it seems like to me with nutrition, once they decide they're going to do something about it, they tend to skip right to, ooh, what's the most restrictive, horrible thing I can do to myself? That's got to be the most effective thing, right?
Yeah. And ironically, sometimes it's not. People, when restrictive diets are difficult and there's a fair psychological burden imposed on someone by undergoing one of these highly restrictive diets. So it's not to say the more restrictive the diet, the better the results. In fact, some of the patients that have come into my office, the real game changer was telling them it's okay to broaden their diets, because they had come in with kind of this indoctrination into fearing tons of foods. Mm-hmm. And when we had the conversation that it was okay to broaden their diet, these people actually improved quite immensely. They stopped withdrawing from social activities, which they couldn't do prior because they couldn't eat anything out anywhere because they were on such a restrictive diet. And that gave them more socialization and time kind of out of their head and out from in front of the computer. They were eating foods that they weren't eating otherwise. They were probably a little bit malnourished previously, so now they were eating more. And everything kind of self-perpetuates in an upward cycle in some of these conditions or some of these cases where people are overly restrictive. So yes, great point. It's not to say that the more restrictive the diet, the better the results will be.
Yeah, that's, I think, super, super useful too. Awesome. And I assume you outlined that progression in your book then, correct?
Yeah, we outline the progression and we first get people in acclimation to the diets. And then we kind of take them through a step-by-step process to figure that out. And I try to be very mindful of making it easy, because the last thing I want someone to do is hear that and feel daunted. We make it very accessible in the book. And the nice thing, so the negative thing about options is options can feel daunting, right? But if you're given the options the right way, then you end up doing only what you need to do and nothing more, but also have the options to get you to the point where you feel well. And so if you approach or you codify the options in the right way, then they can be very empowering rather than overwhelming.
Awesome. And one last question before we get to a little bit more info on the book is your thoughts on probiotics, which I know could be like probably an 8-hour lecture, but I've heard different thoughts from, just go ahead and use them. They seem to be beneficial. There's not much downside to, you're only replacing a couple of bacteria that are in there, so maybe you should rotate through different categories or different brands or different amounts to, some people are not a fan of them because the amount that you would be supplementing is very restricted compared to the amount you would have in your gut. Mm-hmm. Any general thoughts along those lines?
Yeah, all great points. Step 2 of the protocol that we lay out in the book goes through probiotics. So that's one of the first things that we recommend if people don't respond optimally to diet is probiotics. And I should maybe just zoom way out for a second and mention that while there are a number of diets that we can utilize, it's important not to try to force a dietary solution to what might be a non-dietary problem. So in my case, the solution was not a magical diet. It was the amoeba that was poking holes in the lining of my gut and causing tons of inflammation. So we want to give diet its due, but we don't want to try to force a dietary problem to what might be a non-dietary solution. So first part of the book, or first step of the book, we go through some diets quickly to try to get you feeling well. If we don't get optimal resolution from diet alone, we move to other interventions. The first of those, as laid out in step 2, is probiotics. Now with probiotics, you're correct. Most probiotics do not colonize you. So that's a misnomer, thinking that I'm deficient in bacteria, and if I take these bacteria, these probiotics, I will recolonize. That's actually not what happens with the majority of probiotics. Most probiotics actually may exert more of an antibacterial effect. And this is why we have high-level scientific data like meta-analyses showing that probiotics can decontaminate small intestinal bacterial overgrowth in patients that have it, and also work as effectively as some antiprotozoal or antifungal drugs against protozoa or fungus. So part of the utility, not all of the utility, but part of the utility from probiotics may actually be their antibacterial, fungal, and protozoal mechanisms that allow us to rectify dysbiosis that might be occurring in the gut. So it's important to understand that. Then to the comment of using different strains or formulations, there is something to that. And one of the things that we talk about in the book is how we can classify probiotics really into, for functional purposes, about 3 categories. If you wanted to be academic, we could say 5 categories. But when you look at probiotic products, it's dauntingly confusing because there are hundreds and hundreds of products. What most people don't realize is that if you look at all the products, you can usually classify any given product as category 1, 2, or 3 of probiotics. Category 1 is predominantly a Lactobacillus bifidobacterium mixture. Category 2 is a Saccharomyces boulardii. And category 3 are soil-based organisms, usually having the bacillus or the species designation of bacillus. So you have your Lactobacillus bifidobacterium blends, kind of like a VSL3. You have your Saccharomyces boulardii probiotic, and then you have your soil-based probiotics. Those are your 3 classes or categories of probiotics, and it's important that people try one of each of those categories to see what seems to be a best fit for them, because some people will have remarkable improvements from Saccharomyces boulardii, but notice nothing at all from a Lactobacillus bifidobacterium blend. So rather than trying to arbitrarily jump from product to product to product and not realizing that you're going from a category 1 product to another category 1 product to another category 1 product, they all just have different names. What we'll do is we'll try a good product from category 1, see how you do, then try category 2, then try category 3, and find the one or the mixture of the 3 that work the best for you.
Cool. That's awesome because, yeah, to your point, I've seen people that are using very much the similar category, just a little bit stronger. It adds a few more different bacteria, but they're not in completely a different class. So I know one thing that helped me, even with clients, was having them try a soil-based probiotic. That seemed to work pretty good for a fair amount of them. So I think having them broken down by different classes makes sense. So you're not trying to reuse the same category all the time and pulling your hair out going, wow, why is nothing working? I don't know what's going on. I've tried, 5 different probiotics.
Exactly. And then on the other side of the coin, if you were to have a formula that had all 3 in one, it's not necessarily a bad thing, but some people do have a negative reaction to one class of probiotics. So if you can break them apart, you can isolate where the reaction is coming from and be able to be a little bit more prescriptive in how you dose this or dose these.
Cool. Awesome. Well, that's great information. Super appreciative. And tell us a little bit more about the book, and we'll put a link down here below where people can pick it up too. But what is kind of the top overview of the book? What is unique about it?
Well, the book is entitled Healthy Gut, Healthy You, and it's available on Amazon. And essentially what I tried to do is give people a practical and very applicable guide to restoring their gut health. This is not the book that's going to talk for 200 pages about how gluten is bad and then end with just a recommendation for a gluten-free diet, which is all fine and good, right? But I wanted to give someone kind of the meta view on their gut health and how to incorporate all this different stuff they hear about: gluten-free, low FODMAP, paleo, low carb, high carb, probiotics, antimicrobials, fiber supplements, prebiotic supplements, how enzymes, digestive acids. How do we integrate all this into an approach that's going to be effective rather than just hopping on whatever protocol is in vogue at the moment? So the real objective was to give people a very applicable book, but it's also highly referenced. There's just under 1,000 high quality medical references supporting the approach used therein. And so it's not to say this is just something that I found to work well in the clinic. I mean, it does work fantastically well in the clinic, this approach, but it's also been refined by looking at the medical literature and refining the approach. But in short, I wanted to give someone the one resource that they would need to pull together everything that's salient to their gut health, and then walk them through a personalized step-by-step protocol to apply it.
Awesome. Yeah, that sounds very useful, and I think it kind of weeds through a lot of the information out there. Because as you know, there's a lot of great information, and there's a lot of information that, we've been to, we'll say, other seminars of speakers and kind of looked at each other very curiously.
Yeah, I feel for today's healthcare consumer, because I look around and I definitely see that there's a fair amount of using science as a marketing tool. So you have science, masquerading, or you have marketing that's masquerading as science, but it's not really science. It's twisting a fact to look like something that is truthful, but oftentimes an intellectually dishonest argument is being made trying to sell a test or a supplement or what have you. And then sometimes these things are just done out of honest confusion, right? People think that they're doing the right thing, but they perhaps haven't taken the time to really go through the evidence and review it fully to come away with the best conclusion. But nonetheless, this produces a lot of conflicting opinions out there, and it makes people very confused. And so, if we could give people the gift of not being confused, I think that would go pretty far.
Yeah, and that's the thing I liked about the book, is it's very straightforward. It's easier to follow, and there's actually references in it, which I always like to see. And it's a tricky thing to write something that is useful, that is based on your clinical experience, because, while science is great, we don't have all the answers figured out yet. But still as a basis on science, and if people want to go farther down that rabbit hole and do more of the research, then all the references and everything else are already there for them, which, that in and of itself saves people just a massive amount of time, even if they do want to go a little bit deeper down into the weeds.
Right. Yep.
Awesome. Well, thank you very much for joining us here today. We greatly appreciate it. And
thanks for having me.
Check out the link on the page here, and you can pick up the book for low cost and put it to use.